Well, in this Heart Month and Valentine's Day week, we have three very good studies to highlight, two of which are guidelines put out by the ACC and AHA. So at the number 3 spot is a brief update to the atrial fibrillation guideline that has dabigatran added as a new option for anticoagulation. And this is a Class 1 recommendation, level of evidence B, with one trial, where it's said that dabigatran is useful as an alternative to warfarin for prevention of stroke or peripheral emboli in patients with paroxysmal or permanent atrial fibrillation and risk factors for stroke who do not have a prosthetic heart valve or hemodynamically significant valve disease, or severe renal failure with a creatinine clearance of less than 15. Advanced liver disease or baseline clotting disorders or other contraindications. This is an agent that's been added in the United States at 150 milligram twice a day dose. For those with creatinine clearance between 15 and 30, a dose of half that, of 75 milligrams, which would be the equivalent of 150 milligrams, is approved. Outside the United States, a dose of 110 milligrams has been used. Both the 110 and 150 were seen to be effective in the RELY trial, but the 150 milligram twice a day dose was superior to warfarin with equivalent bleeding, and that's the one that the FDA approved. And so for the first time in more than 50 years, we have a new anticoagulant for atrial fibrillation. And of note, several others have been tested and may be coming soon. At the number 2 spot is an interesting analysis from Get With The Guidelines Stroke, where time to treatment with thrombolysis was seen for stroke to be associated with improved mortality. This was an analysis from more than 1,000 hospitals and 25,000 stroke patients, where they looked at treatment with TPA within the first 3 hours, as is the current guideline, finding that just a quarter were enrolled in the first hour and treated in the first hour. Predictors of that were younger, less sick patients, but also hospitals that had higher stroke volume treatment. And importantly, for every 15 minutes that TPA was given more rapidly, mortality was 5% lower. And so by cutting off an hour, one could save 20% on mortality from stroke. So an important analysis that says we don't have a 3-hour window, but we have to move as quickly as possible in treating stroke. And then at the number 1 spot, the ACC and AHA and many other organizations have released this Valentine's Day week an update on secondary prevention of heart disease for women and actually also primary prevention. The guidelines that they suggest follow the general guidelines, but do make note of the fact that there are several things that are contraindicated and shown not to be helpful. Hormone replacement therapy, antioxidants, and folic acid all have been shown to not improve outcomes. And they do note also that aspirin for women under the age of 65 has not been shown to prevent MI. The guideline is up to date, does include dabigatran for patients with atrial fibrillation, and also includes omega-3 fatty acids amongst all of the other secondary and primary prevention measures. And so definitely a very useful guideline for treating heart disease in women. So with this week's Cardiology Countdown, I'm Chris Cannon.